Exercising after heart surgery. The importance of activity. Activity improves cardiovascular recovery, increases muscle strength and flexibility, and promotes faster healing. Equally important is that activity significantly reduces your chances of complications such as blood clots, pneumonia, skin breakdown, and back pain. Activity is important very soon after your surgery, starting with your stay in the hospital. Most post-surgical patients are standing and sitting up in a chair on the first day after surgery, and hopefully walking around a little bit the day after that. In the first few days, try to spend a little more time each day out of the bed and sitting up in a chair. Initially, this may be just for the hour or two around meal times. As you are feeling more confident and independent, you should take short, frequent walks in your room and into the hallway. Ultimately, you should be walking 3 or 4 times throughout the day by the time you are discharged home. Whether it is sitting up or walking, it is always better to have short, frequent sessions of activity rather than only one long session. Symptoms to watch for. Extreme shortness of breath. You should be able to talk without gasping while you're walking. If you can sing, you can probably work a little harder. Cardiac pain. Some incisional pain is expected, but any chest pain similar to what you experienced before your heart surgery should be reported to staff. Dizziness, faintness, nausea, or blurry vision. Significant fatigue that persists an hour or 2 after exercising. Excessive sweating or cramping. Your recovery at home. You should continue with your activity progression at home. Most normal day-to-day activities are encouraged as long as they are not putting undue stress on your sternal incision. Get up frequently and move around the house. Walk outside if the weather is suitable. If the weather is not suitable, find a place indoors where you can walk. For example, the gym, the mall, or a community center. Your home walking program. It is best to focus on the duration or time you are walking. Most people are able to walk between 3 and 10 minutes consecutively by the time they leave hospital. If you are walking fewer than 15 minutes at a time, walk 2 times a day. Increase the time of walking by 1 minute every 1 or 2 days. Fight the urge to jump ahead to a much longer walk just because you are feeling good on a particular day. Gradual progression is best. Remember that it is normal to have off days now and again. On those days, do not try to progress your time. If you can, keep walking but stay at a comfortable level until you are ready to progress again. Once you can walk for 15 to 20 minutes consecutively, focus on just walking once daily. Most, but not all people, will have progressed to walking 30 minutes consecutively by 4 to 6 weeks after surgery. When you can walk 30 minutes, you can add more structure to your walk so that it consists of a warm-up phase for the first few minutes, a conditioning phase, which you will build up to 30 minutes, and a cool-down phase. The rating of perceived exertion is used to know how hard to work. Rating of Perceived Exertion Scale, or RPE. This is a subjective rating of how hard you feel you are working or exercising. On a scale from 0 to 10, 0 would be no effort or resting quietly, and 10 would be maximal effort or working very, very hard. Warm-up phase, the first 5 to 10 minutes, and the cool-down phase, the last 5 to 10 minutes, should be easy or very easy, or a 1 to 2 on your RPE scale. During the conditioning phase, or the middle 30 minutes of the session, you should be working in the 3 to 4 range, which is rated moderate to somewhat hard. Stretching exercises. The exercises in your patient education booklet are suitable for maintaining or increasing flexibility. They are often helpful in warming up before your walking program. Hold stretches gently for 15 to 30 seconds. There should be no pain in stretching. Avoid bouncing or quick repetitions. Do not hold your breath. Try to breathe slowly and comfortably. Sternal precautions. Although it is important to use caution when using your arms, the goal is to gradually return to normal movement and activity. Your pillow is helpful when moving in bed and coughing, but you do not need to hold it to your chest all the time. You can move your arms as you normally would, especially when you are walking. For the first 6 to 8 weeks, use caution for the following. Avoid exercises that focus on your arms. Avoid lifting, pushing, or pulling more than 10 pounds. Avoid activities that involve raising your arms above your head with weight or for longer than 2 minutes at a time. If possible, use both arms to carry objects so weight is distributed evenly. Use both hands to open or close heavy doors. When standing up from a chair, focus on using your legs, not your arms. If you must use your arms, ensure they are kept close to your body and that it is equal on both sides. Avoid overreaching continually. Don't overstretch your chest. To get from a lying to sitting position, bend your knees so that both feet are flat on the bed. Reach your arm across your body to ensure that your shoulder comes off the bed. Don't leave your shoulder behind. With knees bent, roll fully onto your side, keeping the legs on the bed. In one movement, drop your legs over the edge of the bed, using momentum to bring yourself into an upright position. You may need to use your arms a little bit, but keep them as close to your body as possible. To get from a sitting to lying position, make sure you are seated closer to the head of the bed than the foot. It's easier to move down than it is to push up. Lean onto your forearm. Lift your legs onto the bed and roll onto your back. To get out of bed, start by bending both knees up so your feet are flat on the bed. Reach across your body to roll fully onto your side. Drop your legs over the edge of the bed and use momentum to sit up. You may need to use your arms a little bit, but try to keep your arms as close to your body as possible. If you're having difficulty lifting both legs onto the bed, lean down onto your forearm, bring your top leg bent with bent knee up onto the bed, and then roll onto your back as you lift your second leg onto the bed. To stand up from a chair, use your hips to shift forward to the edge of the seat. Bend your knees and place your feet firmly on the floor behind your knees. Lean forwards and up so your nose comes forwards over your toes. It is important to do your deep breathing exercises following surgery to ensure you keep your lungs clear. Try to inhale through your nose and exhale through pursed lips. Let's try a couple deep breaths in. You want to avoid slumped posture, so sit straight with your shoulders back and relax down and your head up. Take a deep breath in through your nose and exhale through pursed lips. And in through your nose and out through your mouth. Now try and count to 4 on your inhale and on your exhale. So let's try that one more time. Deep breath in, 2, 3, 4, out, 2, 3, 4. In, 2, 3, 4, out, 2, 3, 4. Now let's see if we can try a brief hold at the top of your inhale. So when you get to the top of your breath, you're going to hold it for a 1, 2 count. So deep breath in, 2, 3, 4, hold it, and blow out, 2, 3, 4. And one more time, in, 2, 3, 4, hold it, and blow out, 2, 3, 4. If you need to cough, ensure you use your pillow to firmly support your chest when coughing. Your pillow is helpful when moving in bed and coughing, but you do not need to hold it to your chest at all the time. You can move your arms as you normally would, especially when you are walking. General advice: do not hold your breath during exercise. Wait 30 minutes after eating before exercise. Speak to your doctor about when you can begin to drive again. Avoid hot tubs, swimming pools, or soaking in the bath until approved by your doctor. Avoid exercising outside when it is very hot or very cold. If you have dental work within 6 weeks of your surgery, antibiotic coverage is recommended.